Good morning everyone. Today we are going to talk about the anatomy of retina. Before going to the retina, let's discuss about the layers of eyeball. As we all know, the outermost layer is sclera, and then there is choroid, which is the vascular layer of the eyeball, and the innermost layer of the eyeball is retina. It is the highly developed tissue of the eye and it is thin, delicate and transparent. And now talking about the gross anatomy of the retina, it extends from this optic disc to the ora serrata. And optic disc is the head of the optic nerve, and an optic disc, all the layers of retina terminates except the nerve fibers which passes from the lamina cribrosa to the optic nerve, and a depression seen in the optic disc is physiological cup from where the central retinal arteries and veins emerges. This area is also known as the blind spot because there is no presence of rods and cones in this area. And as you all know, the outermost layer of the retina consists of pigment epithelium, which is towards the choroidal side, and there is neurosensory retina from where the optic nerve arises and continues to the central nervous system. And this ora serrata is the serrated margin where the retina ends, and here retina is firmly attached to both vitreous and choroid, and pars plana extends anteriorly from here. Retina is the light sensitive tissue due to the presence of rods and cones, and the light passes through the lens at the front of your eyes and hits the photoreceptors that are present in the retina and changes the light energy into the electrical energy. And now talking about the fundus, it refers to the dome-shaped interior of this eyeball, and grossly fundus can be divided into two regions, that is posterior pole and peripheral retina, which is separated by an imaginary line that is known as the retinal equator. And this fundus is made up of retina, macula, fovea, this optic disc and retinal blood vessels. And now talking about the macula, it is also known as the alloy spot, and it has a central depressed part that is known as the fovea centralis. It has the highest visual acuity because it contains cones only, and these are the central retinal arteries, which is the branch of ophthalmic artery, and these both central retinal arteries and central retinal veins supplies to the retina except this macular region, and this macular region is supplied by choroid.